Good day, everyone. I believe you're fine at wherever you are. So today, being the 10th of November 2025, is our eighth day. Yeah, the eighth day on our target of 10 days discussion on topics of interest on health. So today we are talking about the health and the care of your lungs. So the thing is, according to the American Lung Association, your lungs is the centerpiece of your respiratory system and is always at work to see that your respiratory system functions well. And then, according to the American Lungs Association, each day we take about 23,000 breaths. And as we breathe, the lungs filter out waste and move the ever important oxygen into our bloodstream and to all the cells in the body. And then, the human body, as we age, certain functions and even our organs begin to decline in capacity. And this is not different for the lungs. But here are some 10 important health tips, according to the American Lungs Association, that can help to keep your lungs ever glowing and ever working to ensure that you are functioning well generally. So first, stop smoking. And don't be a second-hand smoker. Yeah, when we talk of being a second-hand smoker, you may not really be the one smoking, but when you are around an environment where people are smoking and you're breathing in that exhaled air, it can have impact negatively on your respiratory system. So that's the first thing. Stop smoking, because smoking substances like cigarettes, it's not good. It impacts negatively on your lungs, and it can cause some chronic inflammations or even swelling in the lungs, or puts your respiratory system at risk of developing conditions like lung cancer or chronic obstructive pulmonary disorders. So the second point is regular exercise. All through this health series, we have talked about exercise because exercise impacts on your health positively, and it is not different for the function of your lungs. The third one is maintain a healthy diet and stay hydrated. Yes, we have mentioned this over and over again. So it is not different for the function of the lungs. You also need to maintain a healthy diet. I've always talked about this. When it comes to dieting, you can meet a dietitian, you can meet a nutritionist. So where you are having concerns or you don't know how to go about it, your doctor can put you through on the right people to meet for your professional concerns. Then the fourth point is get annual checkups. Yeah. There are times I feel as humans, we should just apportion some income for regular health checkups. Yeah, it's not good to only wait until maybe you see symptoms. So yeah, sometimes you can do the scheduled regular checkups without necessarily waiting for symptoms. And then if you're paying attention to your health and you see some respiratory symptoms that are not good, that is also a good avenue for you to seek for medical health. Okay, medical checkups. Then the fifth point is stay updated with vaccinations. Yeah, vaccines are especially important for people with lung diseases, as this can prevent serious conditions. Then the sixth point is avoid outdoor air pollution exposure. Yeah, there are certain areas that sometimes the chemicals circulating there or some harmful substances circulating in the air can be dangerous to your respiratory system when you smoke it, like when you breathe. So in such areas, there should be some protective gadgets that you should wear to prevent your direct inhalation, which can impact negatively on your respiratory system and that of the lungs as well. Then improve indoor air quality. I always talk about this. Clean your space, do your high dusting, and all these things helps to reduce dust, or even within your environment. If you're somebody that is sensitive to some chemicals or some smells, there are certain things you should not have in your indoor space, because it will impact negatively on you and the air that you're breathing inside your room. So this is something important that should be considered, putting your internal environment at a very good pace. Then the 8th one is practice deep breathing. Breathing exercises helps the function of your respiratory system. So it helps to improve the lung strength and endurance, which in turn increase both inspiratory muscle function and the amount of air inhaled and exhaled voluntarily. Then number 9, maintain good hygiene. Wash your hands. The truth is, hand hygiene is very important, because some microorganisms can be transferred through surfaces that we place our hands on, and indirectly, if at any chance you bring it closer to other surfaces, you can still have to it can impact negatively as you inhale, or sometimes mistakenly people still put their unwashed hands in their nostrils. So this can cause transfer of bacteria, which is not healthy. So hand hygiene is very, very important. So we advise people to use hand sanitizers as a backup where running water is not readily available. Then if you are at risk of infection, staying socially distant or wearing a mask can help you avoid contracting or spreading an infection as well. Then number 10, get screened for lung cancer. Yes, low dose CT scans can reduce deaths in those at high risk by detection of lung cancer before symptoms appear. So the test is not recommended for everyone. So talk to your healthcare provider to determine if you're eligible. Hi, so I believe that you have been able to learn one or two things. If you think I've missed anything, it's a good ground for you to comment in the comment section. So thank you so much for staying tuned, and then see you in tomorrow's episode. Bye.